And this morning we welcome our friends from Titusville Area Hospital. Holli Wolfe joins us. Holli, this is a very special morning, and you brought in a very special guest, somebody that we've been talking about for a few months.
Yes. This is Dr. Dvorkin. He's our new orthopedic surgeon at Titusville Area Hospital. We are so happy to finally have him. We've been anticipating his arrival for several months, and he is finally here and starting to see patients at the hospital, and we're really happy to have him.
Doc, good morning. Welcome.
Good morning. Pleasure to be here.
It's great to have you here. Again, everybody's been very excited to meet you, and we've had a chance to talk this morning, and we want to learn more about you. So tell us a little bit about yourself.
Well, I'm an orthopedic surgeon, obviously. I've relocated from Baltimore. I was in Baltimore for 35 years. Basically do general orthopedics, but my love is total joint replacement as well as arthroscopy, putting a TV camera into a joint, minimally invasive type of procedures. After 35 years of living in a big city, I thought it was time for a change, and Titusville opportunity manifested itself to me, and here I am.
At what point in your life did you know, but this is what I want to do?
You know, it's funny. I come from a family that had several orthopedic surgeons in it. Grew up in the Bronx in New York City, and my parents emphasized that I was going to be a doctor. I had no choice. So being interested in the medical profession and having family members in orthopedics, that's where I went to. You know, it's orthopedic surgeons are usually the people in the class in medical school that have been athletes in the past, and obviously I was an athlete, not a very good one, and so taking care of athletes is what I like to do.
What kind of sports do you enjoy?
Basically, I love football. I wrestled in college, but like running, and my new love is fly fishing.
You come to the right area then, because this is wonderful for fly fishing.
That's what they tell me. I'm all equipped. My wife bought me fly fishing lessons, and I'm ready to hit the water.
It's like golf lessons, though. It really doesn't do you any good. You just
No,
go out
I can
and
vouch for that.
Oh yeah, well, you're supposed to golf today.
I'm supposed to golf today.
Hey, good luck with that.
Yeah.
Doc, for you, what's changed in your profession over the past 20 years? I'm sure technology's just been amazing.
Yeah, technology really has really changed a great deal in orthopedics. Obviously, as every specialty in medicine has, minimally invasive procedures using the smallest incisions possible to really expedite recovery is where we go. Arthroscopy, once again, is an operation which we can do in the knee and the shoulder, where we do little puncture marks, and we can pop a TV camera into the joint, take a look at the problem, and then fix the problem. Before, where we had to make huge incisions, maybe 6 to 12 inches long, we can now do with little microscopic little
Wow.
openings. The other thing is computers. Total joint replacement is something that's been done for a long, long time, but now we are using, and I use a computer system which enables me to make more precise cuts.
So I know in this whole process, Titusville and Meadville do their research and trying to find the perfect fit.
Right.
But I'm sure you've done a little bit of research to see, who your colleagues would be if you were to take this position. How much research did you put into, just seeing who you'd be working with if you took the position here in Titusville?
Well, obviously, Titusville Hospital is not a large institution. I come from a 400-bed hospital with about 350 medical doctors on staff. Titusville basically has 24. Me, I guess I'm the 25th. So I was able to find the names of these doctors and basically investigate or go over their resumes. And I was amazed to find that the quality of a doctor at Titusville is superb. It's first rate. Then it was bringing the wife with me to take a visit for the area, walking around. And my wife and I, when we came here, we immediately fell in love with the town. And looking forward to living here. It's the thing that struck me the most about Titusville are the people. I am a people person. I treat my patients as I would treat my own family. And just walking around here, people know who you are. They know your name, and they know that I was coming. I felt like you know, a rock and roll star, which is, and I can't sing or dance, so that's a good thing.
Right.
So I'm looking forward to that ability. You know, I come from a hospital which was owned by nine hospitals owned one corporation. I was treated as a number. I was inspected to see a lot of people and had no time to interact, and that's something that I sorely missed, and that's what made me make this decision in my life.
You know, it's funny you say that, because usually you hear the opposite, right? The patient saying, well, I'm just a number, you know, nobody knows my name. I'm, you know, I don't have that one-on-one with, you know, the doctor. But you also experienced that same thing, right? Where you said you felt like a number.
Absolutely correct. I mean, you know, you'd be crazy if if you're working in the office from 9 until 4 every day, and my patients are my friends. I mean, if I don't have time to interact with them, find out what's going on in their lives, it's going to be an incredibly day of not being able to interact. So I like that. It's like, you know, that's what I enjoy.
I think it's funny when you talk to doctors in Meadville or Titusville. You know, they'll be at the store and somebody will come up and be like, "Hey, doc, I got this," you know, and they look there right in the middle of the store. But that's the kind of relationship that the doctors have with the patients in the community. It's funny to hear, but it's also true.
Yeah.
I totally agree. I mean, it's. I always joke with my wife about the fact that I'll go in a party and before I'm there 5 minutes, people are having their shoes and socks are off. But you know, it's I like that. I mean, and the aspects of Baltimore that I liked is I loved running into my patients. I remember just a couple of weeks ago, I was in the ice cream store, and a guy comes up and says, "Hey, Dr. Dvorkin, you did a great job on my hip," and you know, and that's something that I really enjoy. It's nice to get the feedback. It's nice to know the people, and it's nice to know that you've made a difference in their quality of their life.
And now, if you could only get a quarter for every time somebody said, "Hey, doc, is this normal?"
Yeah.
Then, Holly, for you, a lot of preparation went into. I mean, this was exciting news.
Yeah.
So talk about sort of that process and bringing the doc into town.
Well, we had been looking. The hospital had been looking for some time, and you know, we found Dr. Dvorkin, and so he came and interviewed, and you know, that's been kind of a long process. I think, when did you come in for your first interview? April, was it?
I think it was April or May.
Yeah, somewhere along there. So you know, there's many things that go into that. You know, he practiced in Baltimore, so you know, licensings and different things like that, and credentialing, and so there is a long you know, working as a nurse or something like that might be a little bit easier to just jump into, you know, a new position somewhere else. But as a physician, there's a lot that goes into it. So we've been working diligently to get all of those things, all of our I's, T's and crossed and I's dotted as quickly as we can, and to make sure we can get up and going.
Now, you had also said there was probably about a month of going back and forth and the effects of bringing a Ravens fan into the community.
Yeah, well, we had to make sure everything was situated and there wouldn't be an uproar, but I think we're good.
I was going to keep that quiet, but now I think
sorry about that.
I don't think I have any choice right now.
That's all right. Doctor, you had mentioned just some of the benefits of being in a smaller town. Already people have been coming up to you and welcoming you. That's going to be odd I mean, you officially start when, today?
Today is my first day I see patients in the clinic in Titusville Hospital.
Yeah, and that's incredible. For the people are already welcoming you to the community, and today's the day you start. So that's got to tell you something about the area.
You know, it is. You know, it's nice to be wanted. You know, and now I know what the band leaders of Aerosmith feel like when they go there. So it's something that you know, being an orthopedic surgeon, I've never been a celebrity, but it's nice that people know me, and obviously there is a significant need that I'm meeting.
Sure, absolutely.
You know, there hasn't been an orthopedic surgeon in Titusville for 2 years, and the patients have to travel to Meadville, and that's a long way. I haven't done it yet, but I imagine it's going to take me 45 minutes to an hour, and that's a long way to have to travel if you break a bone. Now we're able to keep those patients here in Titusville, and I think that it's something the community deserves.
Yeah.
So, Holly, what's the best way to begin this process? Because there are a lot of people that have been waiting for this,
Right.
and excited about this opportunity.
Yeah, actually, in fact, I was at the fair yesterday, and I had some of his information there, and was talking to just about everybody that walked by that was willing to talk to me.
What do you mean willing? There was a line of people.
Tons of them. Yeah, it was the donkey booth.
It was. Yeah, they thought she brought a pig to raise, but that's.
Anyway, so people are very, very excited about it, and of course it was Titusville Day, so there was lots of Titusville folks over there, but everybody's really excited, and just to hear that he's finally here and we're ready to go. Of course, I've been advertising and things like that, but he's here now. So if someone wants to make an appointment, they can call the hospital. The number is 827-3400 to make an appointment, and he is seeing patients in the clinic now. So, and that's on the first floor of the hospital where all the other physician clinics are at. So, it's a very convenient location all around. Most people might need an x-ray or, things like that, and they can just go downstairs and get that done, and it's really pretty convenient. So.
Doc, for you, I was not surprised, but kind of excited to see, as we were talking this morning, that there's that transition period from where you were to here, but you were excited to get back to work. It wasn't like, hey, I'm really enjoying this, I think I'm just going to retire. I mean, it was, hey, I'm here, I'm ready to go, let's do this thing.
Yeah, I mean, I was absolutely going crazy. I mean, my profession is my life. I am very lucky in the fact that I really love what I do. So I'm looking forward to getting into the office and starting. Looking forward to starting to do some surgery. Now, obviously, I want to let the population know that surgery is always one of last resort. There are so many new technologies and treatments that we have for treatments of arthritis of the joints. And I'm a person that firmly believes that surgery is the last thing if everything else doesn't work. So we do a lot of injections for arthritis, cortisone, other medicines that's called hyaluronic acid. It's a gel that's made from roosters. We finally got a use for the rooster and the comb on the head. That is a gel that we put in the joint that helps with arthritis. So there are a lot of things that we can do. From walking around Titusville and watching people walk, there's a lot of arthritis here. Mm-hmm. You see that when you go to Perkins, especially. You go there. There are a lot of people that can benefit from me. Mm-hmm. And I'm looking forward to meeting everybody and going from there.
You're watching the Morning Drill on Stream TV in Armstrong and listening to it on the Allegheny News Talk Sports Network, 22 minutes past the hour. That is funny, as you are going around town and sort of taking those notes. I would think those folks are also looking for some answers, some solutions, and it sounds like making an appointment and coming in and seeing you would be a good start on getting that treatment so that they can live a better, fuller life. Right.
Absolutely correct. I've been in practice for 35 years. I come from a large hospital in Baltimore. I was chief of orthopedics for 25 years. Baltimore Magazine is the magazine that basically has an issue once a year for Top Doc. It's a magazine in which our doctors nominate who they feel are the best in the field. I've been top doctor in Baltimore for the last 6 years.
Wow.
So there are a lot of things I know and a lot of things I like to do, but the bottom line is I'm here to make people better. I find that arthritis is a very painful thing to live with. I mean, we bought a home here in Titusville, a nice a house that was built in 1870. Just talking to the people that I have seen in my home doing the work, they don't realize that there's so many simple things that can be done to help their arthritis, medications, injections, and I think that now that I'm here, I'm gonna make people walk better and feel better.
And I know you were pretty excited because you were walking around the neighborhood knocking on doors saying, hey, can I help you out?
Absolutely correct. That's because I lost my keys.
That's right. Sadly, though, this is a community where a lot of people still don't lock their doors. They keep them open. Yeah. But no, Holli, again, this is an exciting step for the hospital as it continues its growth with its partnership with Meadville. Mm-hmm. What's coming up for you guys? What are you guys working on?
Well, actually, I did want to mention this too. We're planning on doing a meet and greet with Dr. Dvorkin. So that should be, we're planning for Monday, September 24th. We're going to have it at Cross Creek. So we're going to have a meet and greet. And then after that, he's going to do a presentation for total joint replacement.
Very nice.
So, yeah, so anyone out there in the community that wants to come, it'll be at Cross Creek on September 24th.
And if I'm, correct me here, but that's the Monday Night Football game with the Ravens. So that's.
Yeah, maybe.
No, I'm just.
Oh, you got me scared there. I didn't think
He's
so.
like, well,
I didn't sign up for that.
We need to reschedule, Holly.
I'm going to be sick that day.
Anyway, so that'll be at Cross Creek. It'll start around 4:30. We'll have some hors d'oeuvres and things there, and then the presentation will start at 5. So we're hoping to have lots of people come, and they can ask questions and then learn more about total joint replacement, and and we're hoping to get out into just various communities in the area as well to do those joint replacement presentations, and it's really about educating them about like he's saying, there's things that can be done. Maybe it's a conservative methods first, and then to get to the point of joint replacement, but just to help them understand what the process would be.
You mentioned just being out in the community. Doc, you mentioned I think you're going to be at the high school tonight.
Yeah, I'm going to be at the mandatory meeting this evening for the parents and the varsity and athletes. I am quite excited to be the orthopedic surgeon for the Titusville Rockets. So this is my chance to experience Friday Night Lights. So I could not be more pleased to be on the sideline taking care of the athletes and watching a game that I love.
It's funny because you've been talking about some of the older patients, but you also have this passion for the high school kids and just the kids and students of this community. You had mentioned that you were impressed with some of those students you've met so far.
Yeah, I mean, the young kids that I've met here, the kids from the high school are incredibly impressive. Clearly, the community has done a great job of raising good quality guys and girls. I do a lot of sports medicine, and obviously sports injuries are what I love. I mean, I love the shoulder. Once again, arthroscopy, that minimally invasive operation, is like playing video games for me. You look at a TV screen and you can do incredible things now that we used to have to use large incisions to do, and looking forward to doing them here in Titusville. The operating room, which I've been toured about, has really a great deal of the equipment that I've used, and I've been very impressed. We'll bring more in. But yeah, I want to take care of the athletes, and I'm looking forward to being on the sideline.
I think when somebody hears an injury in football, it's like, oh, okay, yeah, I get that. What's a sport that people would be surprised to hear that there's maybe as much injury or more? Is there a sport? I mean, soccer. Is there anything?
I mean, soccer is the same thing. It's the cutting motion, the pivoting motion. You watch the television and you hear about athletes in soccer or football that tear their anterior cruciate ligament, the ligament inside the knee joint that gives the knee stability. You think it's because they got hit by 3 265-pound linemen, but it's during practice when they're just running and they pivot. So that's especially true with women. Women have a higher rate of ACL tears than men, and they're usually non-contact. So it's the sudden motion. The knee joint's a very complicated joint. Not only can you bend and straighten it, but you can twist and it moves sideways, it rotates, so therefore it's very susceptible to injury. It's always the more stable a joint, the less it moves, but the more mobile the joint, the higher the risk of injury, and that's true especially in the knee joint.
Brady, Tom Brady, has his special diet, and he's always talking about keeping the muscles more relaxed than building them up. Is there any truth to that?
I'm sorry, I can't comment on Tom Brady. No, I'm just teasing.
See, we got something similar. We can share
obviously,
here.
The better shape you're in, the better you're going to be. Obviously, the joint has structures inside that give it stability, but the muscles that cross that joint increase that stability. So the stronger you are, the stronger your leg muscles are, the less chance of injury. The lighter you are, the better that chance. But Tom Brady is Tom Brady. He's killed both the Steelers and the Ravens over the years, and whatever rocks his boat. Thank God he's getting older.
That's right. That's right. Doc, great to have you on the program this morning. It's a pleasure meeting you, and I think Titusville and the Meadville communities are very fortunate to have you here, and you're joining a great crew. So congrats and welcome to the communities.
Thank you very much. I look forward to seeing everybody. If you see me on the street, just take your shoes and socks off, and I'll take a look.
That's right. Holly, for you, best of luck today.
Yeah, thank you.
Yeah. Do you have an umbrella?
I have an umbrella. Yes, I do.
But put it down when the lightning starts.
Right.
yes.
I told my husband, I said, if I see lightning strikes, it's for the foundation, it's supporting them, but I am not golfing in lightning.
There you go.
I will not do it.
Thanks, guys. Great seeing you this morning.
Thank you so much.